I'm Adam Gale, and this is my presentation on physiological and psychological responses. So in the primary stage of primary response to an injury, it's about 10 minutes to 7 days, increased blood flow, dilation of the blood vessels, swelling, pain, loss of functions and tissue damage. These are the first response, or the first signs that you'll see to a common injury. The repair phase is around 7 to 21 days after the injury. Only after inflammation has gone down, collagen fibres begin to form around on the injured area, so like a scab or something, and they replace the tissue that has been damaged, so they protect it from any infections that could get in there, and formation of the scar tissue, which then seals up the wound and stops anything else to get infected in it. The remodelling phase is about 6 to 18 months after the injury. It increases the strength of the injured area. Scar will be different. The scar will be different colour. Reduction in swelling. Collagen fibres arrangement become more organised and stronger, so it's less likely they're going to be cut or damaged again. So in the future they're going to grow back stronger and withstand any impacts. Physiological responses. Every athlete is different and they react to different situations compared to others. Athletes will go through different forms of reactions when injured and recovering. So most of them, the common ones are anger, shock, depression and stress. Post-injuries. For injuries, different athletes in different sports will approach being injured differently. Some may be worried, unsure, excited or pressured. These are all post-injury. 4 common sports injuries and how to treat them. For an ankle sprain, to treat it you would use the thing called RICE, rest, ice, compression and elevation. This will allow the sprain to heal effectively by giving what it needs. Shock, temperature controls such as cooling blankets or warming devices give fluids and blood. Improves the blood flow. Extra oxygen is administered either by a tube or nose or face mask. Oops. Wrist sprain, they could use tape that holds the bones together at the joint. This will prevent any further damage to the wrist, so it just keeps it secure so nothing else can move inside to get damaged further. A dislocated shoulder, moving the head of the upper arm bone back into the shoulder joint, and is usually used with anaesthetic, so there's less pain to be felt. Also having a sling to support the shoulder will prevent any further damages and will keep the blood flow going through the arm. So I'm just going to demonstrate two injuries and how you would deal with them. So Callum's just going to come down. Could you lie on the floor, please, Callum? I'm going to treat him for concussion first of all. So I'm going to come to him and see if he's alright and if he's responsive. So first of all, I'm going to come up to him. He looks a bit alert. I can see that he's moving. He is not quite there, but he's almost there. I'm going to talk to him, see if he responds. So Callum, can you hear me?
Yeah, I agree. Yeah.
Yeah. Do you know where you are?
Don't know what's happened.
Alright, so I can see that he doesn't know where he is. Do you know what sport you're playing?
Hockey?
No, right, okay. He's playing football. He's answered me hockey, so he's completely, something's wrong. So I can see now that he's not responding to how I would want him to respond. So I'm just going to put him in the recovery position. So what I'm going to do is put his left hand at a 90-degree angle. So like there. I'm going to put his hand on his cheek. I'm going to bring his leg over at a 90-degree angle bent, and then I'm just going to come here, slowly ease him onto his side, and now he's in the recovery position so he can get further help and he's stable for now. The second injury I'm going to do is for an ankle sprain. So if Callum, you just... So I'll assess situation like how? So Callum, what has happened here?
My ankle, I just feel like I've gone over it.
So see what the injury looks like. See if I can see anything pierce through the skin. So I can't see anything that looks like it's broken. So I just ask, where does it hurt in the ankle or up the leg as well?
It's just the ankle.
So it's just the ankle. I look at just the ankle now. Nowhere else. Focus on that. I'm not going to move at the moment. Does it hurt here?
A little bit, yeah.
Yeah. What about here?
It's all right. No, it's fine now. It's just where you were before.
So it's right at the ankle. So I'm just going to move it ever so gently.
That's fine.
Is that hurting there?
A little bit, yeah.
Can you put pressure on my hand by
Sure.
pushing?
Yeah. Okay.
Is that hurting?
No, it's starting a little bit better, but still a bit of pain.
Do you want to pressure a little harder?
Yeah.
Alright, so what I would do with this is I would bandage it up and get into maybe an x-ray just to see if anything's broken, take it down to the hospital, see if there's any bones chipped. But I'm going to tape it up so it looks, so it's stronger, so nothing can be else damage it or get knocked easily. So this is my presentation, thank you for listening. There we go.